afternoon, everybody. What are being done by associations at present? There are two types of associations. One is the specialty associations or clinical associations like IOA, BOS. These type of associations mainly we deal with practical clinical scenarios and of their specialties and up to some extent few issues connected to medical legal subjects. And then general associations like well-known Indian Medical Association and AMC. And local associations like Malad Medical Association, Andheri Medical Association, something like that. So these associations are having members of mixed specialties. And these associations generally do clinical programs connected to different issues and some medical legal issues also. There is one exception to this, that is Association of Medical Consultants. Before going for that, I would say that IMA at the national level, at the local level, and AMC also, they are doing a lot of work for doctors and for consultants, for general practitioners. Like nowadays there is a lot of transformation in our system, practice system. The policies which are made by government, they are being affected by corporate hospitals. There is hidden agenda. The rules are being made that after 1 decade or 2 decades, running a small nursing home will be very difficult, like NABH norms, and a lot of norms are there which you cannot just follow. The same norms, you cannot implement same norms which is for corporate hospital to the small nursing homes which are less than 25 bedded. So IMA, AMC at their own level, behind the curtain, they are lobbying with legislators, with parliamentarians, they are lobbying and they are doing a lot of, homework, just to influence the lawmakers, just to influence the bureaucrats, that policy should be like that, so that we are catering around 75% to 80% of population is being catered by small nursing homes and doctors. But usually the policies are being made that so that small nursing homes become extinct, maybe after 10 or 20 years, something like that. So the IMA and AMC, they are working on that. And AMC, as far as the AMC is concerned, it is doing a lot of programs and works for helping consultants to run their hospitals as per local municipality and medical legal issues. Most of big associations have their own medical legal indemnity policy, as Dr. Chasnal told just now, that AMC is actually the medical legal professional indemnity policy of AMC is the numero uno. It's a best policy in the market. You can compare with anything, any other policy. It's a best policy, whatever they say. And premium is also very less. In last 2-3 years, they have reduced it drastically. Why medical legal cases happen? It is because of poor doctor-patient relationship. One of the most important things is the poor communication skill. Poor communication. We are taught in medical colleges everything, but how to communicate with the patient. Empathy. Empathy is a very important word. In foreign countries, they emphasize a lot on empathy. In our countries, we learn from our seniors. Sometimes if you are having a good senior, then you will learn how to empathize with patient. But sometimes if you are not having that lucky, then you may not have empathy factor. And usually in government hospitals where a lot of burden is there on doctors, on residents, the communication skill is not that much. It is not possible also because of the overburdened work. And poor doctors' image created by media. We are also responsible for that. In last few years, I am seeing there is sea change. Lot of unethical work is being done by our colleagues who they just don't care about anything. They just want to earn money by any means, that they are spoiling our image of our profession and doctors. And post-COVID feeling by public that doctors are overcharging. In in COVID, because we are having lot of prerogative while we are treating patient. In corporate hospitals, obviously they are working for to earn money, but in small hospitals, wherever during COVID, lot of big bills were made, and people thought that doctors are something like overcharging, and that is also responsible for spoiling our image. Can associations help in this? Yes, association can help. And before going for grievance cell and all those things, I would say that like GIPSA and Ayushman Bharat. GIPSA, this is insurance companies. They are usually in every profession, if you see, charges increase every year because of inflation, 8%, 7% inflation is there. In medical profession, if you are going to GIPSA or insurance companies, most of the time they decrease your charges. And in Ayushman Bharat, ridiculous rates. Ayushman Bharat rates, you cannot just operate on that. There are so many government schemes. So association like our AMC and IMA, they are working behind the scene. They are working very hard to make it realized that by government officials and that parliamentarians that this is not possible. You have to increase the charges. It is not possible that you cannot just simply dictate us terms that itne mein kar do ye surgery, something like that. One thing which I always insist that I have not seen any association doing that we should have a grievance cell in association. There should be a grievance cell. What is grievance cell? If an aggrieved patient gets a platform to vent his ire and their feelings, and if through this grievance cell we are able to address their complaints, then it will become a safety valve for our members. How? This grievance cell will address patients' problems before they go to police and courts, and there will be many medico-legal cases which will be diffused by our associations at their own level, and problems will be nipped in the bud. It's something like Lok Adalat type of thing. 90% of, my feeling is that 90% of patients' problem will not go beyond this level, that is association's grievance cell level. And creating patients' awareness program, we should make patients aware that even if we give our 100%, even if hospital gives its 100% contribution in treating the patient, even then 100% guaranteed result you cannot get. It is not a pure science. Lot of factors that regulate our outcome of the treatment. Then there should be standard operating procedure, consent form standard should be there, and treatment, this should be standardized. Every association, like every state medical council, they should work on that. Like, for example, I will say, just if we have a consent form made by state medical council, like Maharashtra Medical Council, then we don't have to make any separate consent form. Like, if you see in MTP there is a standard consent form given in the MTP Act itself, and that helps a lot to gynecologists. Then getting affidavits from colleagues, it's very difficult. Time is over, I will not go on that. Then task force. Task force is very important. Many associations have made task force at local level of every area to protect their members in case of some violent attack on doctors and hospital. Task force is made of local doctors. AMC has made in every area, and it has helped a lot. And the area where I practice, we have prevented a lot of violent attacks on hospital and healthcare centers because of task force. It is made of doctors, local doctors, and sometimes of some certain security agencies also, and it prevents violence. If a mob at hospital is aware that there are many people in hospital or healthcare center, then in 99% of cases, mob will not attack doctors and healthcare centers. And they know that it may boomerang on them. Individual person is a nice person. Most of us, 99.999%, but when they become a mob mentality is totally different. Mob understands only जब आप वहाँ पे इसलिए पुलिस को भी power दी जाती है. If you, they understand, power understands the language of power. If you are having a mob, तो वहाँ बात करने से most of the time they will not understand. If you are having a mob with you, it will work as a deterrent. Thank you.